Learn the warning signs for stroke F.A.S.T. Imagine you're enjoying a normal day when suddenly, someone around you starts acting strangely. Their face droops, they can't lift one arm, and their speech becomes slurred. Would you know what to do? Recognizing the signs of a stroke quickly can save a life. Let's dive into the F.A.S.T method and learn how to spot the warning signs of a stroke. What is a stroke? A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Brain cells begin to die within minutes. There are two main types of strokes: ischemic, caused by a blockage in an artery, and hemorrhagic, caused by a blood vessel that bursts. Both types require immediate medical attention to minimize brain damage and potential disability. The F.A.S.T method. The F.A.S.T method is an easy way to remember the most common signs of a stroke and what to do if you suspect someone is having one. F.A.S.T stands for face drooping, arm weakness, speech difficulty, and time to call 911. Face drooping. What to look for? One side of the face droops or feels numb. Ask the person to smile, and check if their smile is uneven or lopsided. Why it matters? Facial drooping is a common sign of a stroke. It indicates that the muscles on one side of the face are not receiving the proper signals from the brain. Practical tip: if you notice someone's face drooping, act immediately. Don't wait to see if it gets better on its own. Arm weakness. What to look for? One arm feels weak or numb. Ask the person to raise both arms. Does one arm drift downward? Why it matters? Arm weakness is another key indicator of a stroke. It shows that the brain is not communicating effectively with the muscles in the arm. Practical tip: if one arm drifts downward or the person cannot lift it at all, it's time to take action. Speech difficulty. What to look for? Slurred speech, difficulty speaking, or trouble understanding speech. Ask the person to repeat a simple phrase, like, "The sky is blue." Is their speech slurred or strange? Why it matters? Speech difficulties can signal that the stroke is affecting the parts of the brain responsible for language. Practical tip: if the person's speech is slurred or they can't repeat the phrase correctly, call 911 immediately. Time to call 911. What to do? If you observe any of these signs, even if they go away, call 911 right away. Note the time when the symptoms first appeared. Why it matters? Time is critical in treating a stroke. The sooner the person receives medical attention, the better their chances of recovery. Practical tip: don't hesitate. Calling 911 ensures that the person gets the fastest possible treatment, which can significantly reduce the risk of long-term damage. Other warning signs of stroke. While the F.A.S.T method covers the most common signs, there are other symptoms to be aware of. These can include: 1. Sudden numbness or weakness, particularly on one side of the body, including the face, arm, or leg. 2. Confusion or trouble understanding, difficulty comprehending what others are saying. 3. Trouble seeing, sudden vision problems in one or both eyes. 4. Trouble walking, dizziness, loss of balance, or lack of coordination. 5. Severe headache, a sudden, intense headache with no known cause. Why acting F.A.S.T is crucial. Every minute counts when it comes to treating a stroke. On average, 1.9 million brain cells die every minute that a stroke goes untreated. Quick action can mean the difference between a full recovery and long-term disability or even death. Early treatment can help reduce brain damage and improve the chances of recovery. What to do while waiting for help. If you suspect someone is having a stroke and have called 911, there are a few things you can do while waiting for emergency services to arrive. 1. Keep the person calm. Reassure them that help is on the way. 2. Monitor symptoms. Note any changes in their condition and relay this information to the emergency responders. 3. Avoid giving food or drink. This can prevent choking if their ability to swallow is impaired. 4. Prepare for CPR. If the person becomes unresponsive, be ready to perform CPR if you are trained to do so. Special considerations for women. Women can experience unique stroke symptoms that may be more subtle and easily overlooked. These can include: 1. General weakness, an overall feeling of fatigue or weakness. 2. Disorientation and confusion, memory problems or difficulty thinking clearly. 3. Nausea or vomiting, unexplained feelings of nausea or actual vomiting. Because these symptoms can be mistaken for other conditions, it's crucial to consider them in the context of other stroke signs. The importance of prevention. While knowing the signs of a stroke is essential, prevention is equally important. Here are some tips to help reduce your risk. 1. Maintain a healthy diet. Focus on a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. 2. Exercise regularly. Aim for at least 30 minutes of moderate exercise most days of the week. 3. Avoid smoking. Smoking significantly increases your risk of stroke. 4. Limit alcohol. Drink in moderation, if at all. 5. Manage chronic conditions. Keep conditions like high blood pressure, diabetes, and high cholesterol under control with the help of your healthcare provider. Conclusion. Recognizing the warning signs of a stroke and acting quickly can save lives. By remembering the F.A.S.T method, face drooping, arm weakness, speech difficulty, and time to call 911, you can be prepared to help someone in need. Educate yourself and others about these signs, and take steps to reduce your risk. Your quick response can make all the difference in ensuring a better outcome for someone experiencing a stroke. Thank you for watching. Please like and subscribe to the channel.